Hello everybody, happy Friday. As promised, I am getting on Facebook Live more often to talk to you guys about various topics related to physical therapy, related to personal development, just to share, my kind of message and what I'm learning and give you guys some value. Maybe not every single day, but as much as I can, so that you guys have something to come to every single day on Facebook and walk away with something to empower you to live a more, to live a life that you want to, and to learn more about physical therapy and taking care of your health and really taking your health into your own hands. So today, especially talking about taking your health into your own hands, I wanted to talk about passive approaches to therapy versus active approaches to therapy. And honestly, this can apply to passive approaches to life and active approaches to things going on in your life, but to make it kind of more relatable or easier to grasp, I want to relate it to physical therapy and passive versus active, and why active is really what is going to empower you to take your health truly into your own hands and heal for the rest of your life, even when you don't have, a physical therapist treating you every single week. So in physical therapy, when I see a patient and I assess kind of what we're working with and what's going on, and I establish a physical therapy diagnosis, and we create a plan based on whatever your goals are. What is this issue limiting in your life? What is it causing you to have to give up, or what's it limiting you from doing in life? And we figure that out. We figure out a plan, and we kind of develop a plan of how we want to approach it. And I choose different things that are called interventions. So whether that is, maybe you need some more flexibility or mobility, so I give you a stretching routine, or there's some strength deficits, so I give you some, exercises that are very specific to the area that you need to strengthen. There's, massage or manipulations, things like that. And so based on in those interventions, some of them are considered passive and some of them are considered active. And I think that if you look at the evidence in physical therapy, some of the more passive approaches, as far as soft tissue mobilization and manipulations, and soft tissue massage and things like that, the evidence shows that patients don't have as good of results as more active approaches like exercises compared to passive. But, physical therapy is, I'm always going to be trying to get an evidence-based practice. So I'm always using the most up-to-date research and evidence to figure out, or to use methods that are going to help with your issue in your diagnosis. But that being said, I think that there is value in some of the more passive approaches, and I think that they hold a place to help you with your healing, to help develop a relationship with me or with your physical therapist and your provider. And the power of human touch is, you can't match the power of human touch. Like, there's a very healing component to the power of human touch. So as a physical therapist, I think that there's value in, putting my hands on the spot that hurts, and putting my hands on the spot that feels tight, and using my manual therapy and my knowledge to try and alleviate some of that pain right out of the gate, and try to show you that I understand that you're hurting, and I understand that this issue is causing you to want to, or it's preventing you from doing some of the things you want to do. And I understand that is happening, and by putting my hand there, I'm showing you that I understand that you're having this pain, and here's how I want to help you to start off. And I think some of that soft tissue work and manipulations and mobilizations and stretching, some of those more passive approach where someone else is kind of giving the input to you. Someone else is doing it for you. So as a therapist, I am the one working on that muscle. I am the one working on the soft tissue and moving things around and helping you stretch and manipulating as far as getting some more mobility through your spine, things like that. And I'm the one putting the input in there to help get that movement. And that is a passive approach. And I think that those approaches have a place, and they're important to help promote your healing process and to help build that relationship between that one-on-one client physical therapist relationship. I think there is a place for those to build that and to help promote your healing. But we cannot depend on passive approaches to life if we want to really truly take our health and take that diagnosis and put it into our hands. And we need to empower ourselves to take action and to be more active in our approach. And this applies to lots of different areas of healthcare. You know, a lot of times my patients come in and they always want to you're like, oh, I love when you do that massage on me. Like, I love feeling that massage, and I love when you put your hands and, you know, move the tissue around or help me stretch, and it feels good, you know? And at the beginning, I think that can be beneficial because you build that rapport. I'm using words that maybe only physical therapists use. You build that relationship, and it feels good. But there's a lot of patients that come in and continuously ask for that, and that's all they want to do. But that's a very passive approach, you know? And then there's some people who, they don't want to do the exercise part. They don't want to do some of the more active stuff because it requires work and it requires them inputting something into their own healing. But that's truly where the healing happens, is when you are empowered to take a more active approach and to take on that work and to take on those approaches where you have to put in a little bit more time and a more effort and more discipline into helping yourself heal. And there's lots of areas like, you know, people love going to get a massage, and people like go to the chiropractor because they always feel good when they get adjusted, and they love going to a physical therapist when they do the massage. You know, their favorite therapist is always the one that does a lot of massage and does a lot of mobilization because they just get to lay there, and you're laying there and you're being passive. And that's not going to, in the long run, help you heal to your optimal potential. You need to have the active approaches too. They both hold a place. And the passive approaches, they will help you feel better for a while. But then when you stop going to why do you think you need to go get a massage again? Why do you think you need to go to the chiropractor all the time? Why do you think that you're coming back to physical therapy after a couple months? Because that intervention, only that healing and that relief of pain only lasts so long. And then you cycle through, you know, because you're not actually getting to the issue that's going on. Why is it so tight? Why is it so painful? Why does your spine need to be manipulated all the time? Because you're not taking any active approaches to it to solve the true problem. You're just covering up the problem by helping alleviate the pain. But then when you stop getting that treatment, it's going to come back. You need to have those active strategies to put into place to help yourself heal for life, you know, for years down, so you don't always have to depend on someone else. When you are always going to those passive approaches, you're dependent on someone. You're dependent on someone else making you feel better. And we need to, you know, empower ourselves and feel like, I want to make myself feel better. I want to develop the tools or figure out the resources or learn the knowledge so that I can feel better on my own. I don't need to depend on someone else. You know, so I, as a, you know, future physical therapist, I don't ever want I love when my patients are going to want to come see me, but I don't ever want my patients to be dependent on me for years, where they feel like they have to be coming in every single week or every single month to get relief of pain. Like, I want to give you the tools and to empower you to take your health and to take your healing into your own hands and have that active approach. So the active approaches are, you know, figuring out the stretches to do, the exercises, what things should you be avoiding in your life, what modifications do you need to make to the activities that you're doing that are causing your pain, what positions are you putting your body in during the day at the office or when you're sleeping or in a car, like what positions are you putting your body in that are promoting the bad posture or promoting your muscles to be, you know, in non-optimal lengths that are causing them to be stretched or causing them to shrink, so then you're really tight. And, you know, what things are you doing throughout your day, and what can we modify? What can we figure out that is going to help you, you know, not have this problem again? So passive approaches and passive interventions can help in the beginning, and I think they have a place in healing. But the active approaches are what's going to really help put your healing and empower you to take care of your health and to solve the problem instead of just cover up the problem and be depending on a provider and be depending on someone else to do it for you for the rest of your life. Like, that's not taking your health in your own hands, and that's not taking responsibility for your body and for your health and how you feel. You know, if that's not taking responsibility for the aches and pains that you have during the day, that's just blaming old age without doing anything about it. You know, we get to this point where you have these aches and pains and you can't move a certain way anymore, you can't lift something anymore, and you just assume that's just age, and that's not the way it has to be. You know, there are ways to overcome that. There are ways to age and still do the things that you want to do, but maybe the reason that you can't do them is because you always stuck to the passive approach. You always depended on someone else to do it for you, someone else to give you the massage, someone else to manipulate you every single month so that you can move, instead of figuring out the tools and the resources to help take an active approach so you can do it on your own. So then a couple months down the road, you start to feel that tightness, you start to feel that pain again. You know what to do. You don't have to call a provider. You don't have to pay money to go see someone. You don't have to be going in and making appointments. You already know what to do. You have the tools, you have the stretches, you have the exercises, you have the strategies to make that problem better and to make sure that it doesn't get worse over time. So the active approaches are what's going to put the health in your hands and what's going to empower you to take control of it and to heal for the rest of your life, to heal for years and years. And that is what I want to instill in my clients and my patients, is that I am here and I have the knowledge and I have the tools and resources to give you, and I can educate you on what's going on with your body, and we can work together. You know, we can work together. I will do some of these passive approaches and these interventions in the beginning, but I will also be giving you the tools to take it into your own hands so that you don't always depend on me for the rest of your life. And so I really want you to think about that in your healing and in your body, is that take responsibility for it and take control of your body. Take an active approach. Figure out the tools, figure out the strategies and the resources to keep your body moving the way that you want it to for life. So you don't have to give up those activities that you love. You don't have to leave your grandkids on the ground. You can still pick them up. You don't have to, give up your Monday night softball league with your buddies, and you can still travel the world. You can still hike. All of those things that make you feel whole and that make your life feel whole. And, don't just chalk it up to old age. Do something about it. Take an active approach and see a physical therapist and figure out a plan so that you can do it on your own, so you don't always depend on someone else. So those are my thoughts kind of on passive approaches to therapy, and this can apply to life. I'm not even going to get into that, but there are so many areas of our lives where we just depend on other people to motivate us or to inspire us, and then they're not around anymore, and then we're just like shit out of luck because we didn't figure out a way to do it on our own. So take an active approach to your life, to your health, figure it out, find the people that can help you. My sisters called me. Use their tools, use their resources, and do it on your own. Empower yourself to heal yourself. Thank you guys for watching. I hope you guys had an awesome week and have a fun weekend planned. Can't wait to talk to you guys again on here soon, but I will see you later.